Hey, I'm Dr. McCleary, and in this video, I want to give you 10 reasons why your memory may suck that aren't you're developing dementia. And we're starting right now. Memory issues are a common symptom that people go and seek medical or mental health treatment for. And many times, what people think almost immediately, once they start to have some memory issues, is that they're developing some form of dementia. Most likely, depending on your age bracket, that's probably not the case. In this video, I'm going to give you 10 reasons why your memory might not be as good as it used to be. I'm also going to give you 10 things that you can do that can help with those things that might be causing your memory difficulties. I want to break this down into 2 simple categories. 1, taking better care of your body, and 2, taking better care of your mental health. Let's start with taking care of your body. Memory issues can be developed by a host of physical issues. One of those issues is connected to your diet. So if you're eating a crappy diet, and most of us know what a crappy diet is, it leads to other issues that can actually cause memory deficits. High blood pressure, diabetes, those type of things are often connected to the food that you're eating. So guess what the remedy is here? Eating better. There are some research out there that says eating the Mediterranean diet, which is largely making sure that you eat fish, cutting back on the red meats, eating more of a plant-based diet, replacing butter with olive oil, those type of things, has been proven in pretty large studies to help with people's memory and to help with some prevention of developing dementia in the future. Another closely related issue for people that are having trouble with their memory is actually physical exercise, or shall I say, a lack of physical exercise. I can go all day to talk about the benefits of physical exercise for folks, but specifically what we're talking about here is actually exercise helping with your memory and actually also being a preventative measure to developing dementia in the future. So guess what? If you're not exercising right now, get there. If you're getting value from this video, go ahead and give it a like so YouTube will show this video to another veteran. Number 3 is drugs and alcohol consumption. And I'm lumping all drugs and alcohol in the same barrel of stuff. That means prescription drugs. That means street drugs. That means alcohol, beer, wine, hard liquor, whatever. Now, I can do a whole video and can talk for hours about how certain medications can affect your memory. But also, illicit drug use and heavy alcohol use has also been proven to negatively affect your memory and your cognitive functioning. It also can be linked to developing dementia in the future. And when dementia or cognitive issues are related to alcohol use, oftentimes they're irreversible. So something to watch: your drug use and your alcohol use. Now you're probably saying, well, doc, I heard that drinking a glass of red wine a day, pretty good for your memory. All right, I'll give it to you. There have been studies that have found that drinking 1 glass of red wine a day can help with cognitive functioning, memory issues, and developing dementia in the future. What they said was 1 glass of wine then say a half bottle of wine. And for folks that don't know, this is a glass of red wine. Not this, and certainly not this. Stay tuned to the end of this video because I'm going to tell you why anxiety, depression, and PTSD can heavily affect your memory. So stay tuned. Another big issue involving your body that we all need, but a lot of us, especially us veterans, don't always get enough of, is sleep. And I'll tell people, if you want some bad memory issues, all right, well, don't go to sleep tonight. See how your memory is tomorrow, or see how your cognitive functioning is tomorrow. So if you're not getting adequate sleep, and that's both the hours and the quality of your sleep, well, you do run the risk for developing memory issues in the future, or maybe even tomorrow if you don't sleep good tonight. So if you're having problems with your sleep and you're having problems with your memory, they may be connected. What you can help with, though, is often your sleep. Whether that's medications, whether that is cognitive skills for such as CBT for, psychologist talk there, cognitive behavioral therapy for insomnia, or other methods that help with sleep. Getting adequate sleep directly affects your cognition. Something to think about. This next issue that affects memory is a bit about mental health and a bit about physical health. So a good one to start right here as we transition to talk more about mental health issues that can affect memory. But what I'm talking about now is pain, whether it's chronic or whether it's acute pain. Pain will affect your memory almost like no other. Because think about it this way. If you're in severe pain, what are you really thinking about? The pain and not anything else. Your attention, your focus is on the pain. And when your attention and your focus is on pain, well, the other things that are going on around you don't get the same attention. And thus, often people develop memory issues that have pain or chronic pain because they're paying attention to their pain, and maybe not paying attention to the rest of the things around them. Because let's face it, when you're in pain, that's what's important. It's not necessarily important where you left your keys. Your back pain is what's on your mind. Chronic pain is something that affects a lot of veterans. And often with chronic pain might come some memory issues. They might be connected. So working on that chronic pain with your doctors, you might find as your pain gets a little bit better, so does your memory. I can hear my fellow veterans talking already. Hell, doc, I got all that. Looks like you got some work to do. As we start to move more into the category of mental health issues that affect your memory, it's important to understand how memory actually works. How our memory actually works is actually rather complicated, but it can be simplified down into 4 steps or 4 actual common issues that affect people's memory. The first one is attention. So often the first step in remembering something is actually paying attention to something. So it makes sense that when people's attention is elsewhere, they often have memory issues. The next one is encoding. The next one is storage. And the next one, or the last one that people are probably familiar with, is retrieval. That's kind of that when you know something, you know somebody's name, it's kind of on the tip of your tongue, but you just can't get it. Or you have a memory, or you have a go to the grocery store, you forgot your list, and you try to remember what was on the list, but you just can't remember what that thing is until you get home and realize that you didn't get that thing. You're like, God, we've all been there. When people have a lot of external or internal stressors, oftentimes that is where their attention is. Oftentimes that's what they're thinking about. Oftentimes that's what they're thinking about, and maybe even the reason that they're not sleeping very well. You can see how kind of some of these things interact with each other. So when you're stressed out, what you're doing in part is taking away from your ability to pay attention to other things. Contrary to popular opinion, we as human beings aren't that great at multitasking. Everything that we do in addition to something takes away from our capacity to do well or to remember something else. So think about times when you've been stressed, or maybe even now. If your memory or if your thoughts are closely connected to that stress, you might find you're dealing with some memory issues. Very common. The next two mental health issues that affect memory are depression and anxiety. Depression and anxiety are often closely linked and often can actually look very similar. But when it comes to our memory, nothing affects our memory almost as bad as depression and anxiety, because that's what's on our mind. And now it's not just on our mind, but it also has infected how we're feeling. So we have multiple things that are pulling away our ability to pay attention to other things, to remember other things. Everything is focused on the depression or the anxiety, or what is causing you to be depressed or anxious, which actually goes into my last mental health reason that affects memory, and that's PTSD. Now, PTSD is a little bit different than anxiety and depression because there are multiple reasons why individuals with PTSD often have memory issues. One of those, which is very similar, is they got other stuff on their mind. When someone has experienced a trauma, often the last thing that they want to do is re-experience that trauma in any way. And with individuals that suffer with PTSD, often what they do is try to avoid all things that look like, smell like, taste like, sound like the trauma, so they don't have to re-experience those things again, so they don't feel triggered once again. When your mind is on making sure that you're not being triggered, when your mind is on avoiding both external stimuli and internal stimuli, well, that can actually be basically a full-time job. And it also affects your memory because you just don't have the room. You don't have the capacity to maybe think about or remember other things. Make sense? Another reason that people with PTSD often have memory issues is not directly attached to the avoidance symptoms, but it may be attached to hypervigilance symptoms. Because when someone doesn't feel like they're safe or doesn't feel like they're in a safe environment, well, guess what? That's where their attention is going to be. Their attention might be having their head on a swivel, scanning rooftops, making sure that them and their loved ones are in a safe situation. This can also end up being a full-time job for people that struggle with turning down that vigilance, the reason that's important with memory is somebody may be paying attention to one thing, maybe their safety, but maybe they're not paying attention to the conversation that's actually going on right in front of them. And when somebody asks them questions about, oh yeah, did you get all that? They might didn't get anything. Some of us have been there. I know this is a lot, but the good news, just like physical health symptoms, is mental health symptoms that cause memory issues can also be helped. So if you're dealing with stress, if you're dealing with anxiety, depression, PTSD, even chronic pain, we have stuff for that. And there are things that you can do to help with not just your physical health, but your mental health that might actually help with your memory as well. Something not just to think about, but something to try. If this video was helpful for you, and I hope that it was, please like it or consider subscribing to my channel if you want to learn more about mental health. But more important than that, if this video was helpful for you, well, that means it can probably be helpful for another veteran or another service member or another friend or family member of a service member. So I ask that you share it with them, because at the end of the day, that's really what all this is about. One veteran trying to help another.